was doing physics and math and undergraduate at McGill, and then got interested in radiation therapists, who thought it would be a good idea to go to medicine. And so I went to medicine. During my medical school, I came across two people who really were influential in my career. One was Doug McEwen, who was a former president of the society, but he was a resident at the time, and I was a medical student. And I spent a lot of time with him as a medical student, learning about radiology, and that got me interested in radiology, basically. Also, during my medical school days, I did a rotation at the Children's Hospital in Montreal with Scott Dunbar. And again, that got me very interested in doing pediatric radiology. So I went to Henry Ford Hospital for my residency. Dr. Eiler was the chairman of the department at the time, who was also an important influence in my career, since a lot of my papers were started during that time, basically, when I spent 11 years at Henry Ford, including my residency and staff privileges. From there, I went to the University of Michigan in Ann Arbor, and there I was co-chairman of the department of the new Children's Hospital, the Mott Children's Hospital, and professor of radiology at Michigan University of Michigan. There I worked with John Holt, who was also a stimulus to my career, and stayed at Michigan for 11 years. And then I was recruited to go to Children's in Chicago, Children's Memorial Hospital, when I went in 1979. And I worked there as chairman for 20 years, and then 10 years for sort of decreasing part-time. And 2 years ago, I retired completely. Well, there's several things. One is the concept of dealing with children, which takes a different kind of technologists and doctors, basically, to be able to handle children who are sick. And this was very clear when we started doing some pediatrics at Henry Ford Hospital, where they didn't have a pediatric section at the time. I got my chairman convinced to have some special text that would deal with children, and all of a sudden our volume in pediatrics went way up because they were able to get much more information. The other thing that is different in children is that we have a different appearance of disease at different ages. It's all completely different in adults, and of course also different diseases occur in children and adults. Since basically radiology is a way of evaluating disease, it really requires knowledge of pediatric problems, and also the difference between the very young and the very different ages of these pediatric patients. I came as a resident in 1969. I was a co-author of a paper on pulmonary veins using tomography, evaluation of left atrial pressure that way. It was very different, of course, than it is now. It was at the Palmer House, and it was crowded, and the exhibit rooms were tiny. So I saw the society change its size and volume over the years. It used to be a much smaller affair than it is now. Of course, when I started, we didn't have image intensification fluoroscopy. During my residency, we had the first image intensified fluoroscope. We had the first automatic film processors during my residency, and so on. Ultrasound started developing with a scan, just looking for midline structures. And then, of course, nuclear medicine developed, and later, of course, CT, MR. And so there's been tremendous changes in our technology and a lot of learning that had to be done as we went along. Well, I like the exhibits, basically. I did a lot of exhibits. There are meetings of the RSNA. I like the courses are excellent. And also you meet people. It's amazing how you walk through the corridors and you still bump into people you know out of the 50,000 or 60,000 people that are here. I presented about papers in courses with 25 meetings of the RSNA. I wrote 62 papers out of the 234 papers that I've published in my life that were all in radiology. And I had a number of exhibits also at the scientific exhibits that I presented. So I've been busy at the RSNA. Well, I encourage them all to join because I think it's a place that they can learn a great deal. I think the courses are particularly good for the residents and the exhibits. Some of the papers are it's too scientific for the residents, but even so, there are a lot of them to present at these meetings. It depends, particularly when they're academically oriented individuals, this is a great place to present your material because there's such a large audience for it.